Dr. Vipan Nikore is the CEO and co-founder of Home Care Hub, an online marketplace to help patients find care at home. He is also the Chief Medical Director of TD Bank, overseeing their health and wellness strategy and helping lead their COVID-19 efforts globally. Additionally, he is also a practicing internal medicine physician and a former medical director at Trillium Health Partners, where he practices medicine and is caring directly for COVID-19 patients. Welcome to the show, Dr. Nikore.
Thank you. Thanks for having me, Raj.
Well, I'm just going to get straight into it. I'm going to ask you the questions that the public are looking for answers on. As you know, there's so much out there in social media and across multiple different perspectives of media. So having the opportunity to chat with you is just, it's such a blessing right now. So in simple terms, first question, can you describe exactly what COVID-19 is? Because there are so many stories out there that the coronavirus has been around for a very long time in many other streams. Is there truth to this? And if so, how is this particular strain warranting the shutdown of an entire world infrastructure? Something that at least in this lifetime, we've never seen happen before.
Yeah, totally understandable. And as mentioned, there's a lot of fact and fiction here. So it's a pleasure to be here. So in very short terms, it's a respiratory disease caused by a virus. And I'll break that down a little bit more. So when people get infections, they're caused by different types of what we call pathogens. That can be, there's many different types, but generally either bacteria or a virus. This here is caused by a virus. So things like antibiotics, et cetera, would not work on viruses. Viruses are, some other viruses we know are like influenza or the flu, or when you think about measles or even HIV, there's a whole range of viruses. So COVID-19 is caused by a virus. It's caused by a virus that sits in something called a family of coronaviruses. And these are common, the term coronavirus, again, it's a family of viruses. So commonly we get different types of coronaviruses. So probably most of us have had some sort of coronavirus in our life. They're usually, the common colds, et cetera. But some of these coronaviruses live within animals. And every once in a while, one of the coronaviruses that lives in an animal makes its way and it jumps. That's what happened with SARS back in 2003 with something called MERS as well. And now it's happened again with COVID-19. So that's what it is. It's a virus. And the symptoms that you get typically are fever and cough being the most likely ones, and sort of fatigue or tiredness. And then when it gets really bad, you typically do get shortness of breath. Other things you might get, a wide range of things from chills to sore throats. I've even seen someone with an earache present, and they ended up having coronavirus. That's not common, of course, but there are other things, even diarrhea, once in a while, a runny nose, but usually not as frequent. The point is there's a variety of different symptoms you can get. Fever, cough, and shortness of breath are the sort of the big ones there. And why is this one making such big headlines? Why are we doing so much for COVID-19 compared to other viruses? So the reason it's such an important, we're taking such strong measures here is, first it's new, right? So if it's new and you can actually stop it before it becomes in everyday life, like the influenza or flu. And now, the flu kills 500,000 people worldwide, somewhere around there each year. And it's just kind of the way it is. And it's unfortunate that it's become that. So why would we ever want to do anything that will just turn into something that's going to cause loss of life every single year? So that's why one reason it's taken so seriously, because we can maybe do something earlier rather than later before it turns into something like that. The second reason is it's actually, it's not as deadly as something like Ebola, if you remember that would kill often 70% of people. SARS would kill around 10% of people. Here, the rates are, it's debatable because we don't know how many people actually have COVID-19, but anywhere between estimates have been on the low end, 0.6% up to 3.4%. But even if you said 0.6%, the influenza or flu kills about 0.1%. The second reason it's extremely important is because, while it's not as, I guess, deadly as you would say it is compared to Ebola, for instance, where Ebola would kill about 70% of people that it infected, and SARS would kill about 10%. COVID-19, it looks like it's going to maybe kill around 0.6% to around 3%. It's hard to say. We're seeing in Italy the mortality or death rates being a little above 10%, but then down in Germany, we're seeing around 0.6%. But even if you take the low end, which I do think it's probably closer to that number, there was a new paper just released yesterday, and they were estimating around that 1% range as well. And even if you take that 0.6%, that's still 6 times more deadly than the flu, right? The flu is only 0.1%. And, again, that kills 500,000 people a year. So, this is a disease that it's still 6 times more deadly than the flu. And it actually is more infectious than the flu. So, how easily does it spread between people? Again, it's not like measles. Measles is probably 10 times more, spreads that much more quickly than COVID-19, but it's still about 1.5 times more infectious than the flu. So you have something that is has a higher rate of infectiousness between people to spread, and it also kills more people. And we have no vaccine like we do with the flu that does help a large proportion of people. So that's why we're so concerned about this. And really, we only have certain measures that we can do to stop that right now. And right now, everyone is working full force to try to stop this train from coming and getting worse.
Absolutely. So as a medical doctor, I want to ask you, you're very privy to what's kind of going on in the trenches. And unlike us on the public side, fact from fiction. What's actually happening in hospitals and other facilities where treatment is concerned, knowing that we don't have a vaccine yet? You've also mentioned that as well. And, there's talks about the fact that, vaccines are kind of, coming close to being available, but not to the public, more for testing purposes. And testing purposes, people are saying, is upwards of 12 months. So is this fact? Is this fiction? Can you just help us understand this a little bit better, Dr. Nikore?
Sure. So I think what's happening in hospitals, it's very dependent on where you are. And I know this show, there's viewers from all around the world. So it really depends where you are. On one end, you have places like Italy, Italy and even New York City, where their hospitals are overrun. They're running out of ventilators or the breathing machines that help people stay alive from this illness. And then on the other end, you have some areas like China and South Korea that are showing signs of now recovering. They're sort of on the tail end. Here in Toronto, where I work, we're probably probably the calm before the storm. We're at the stage where we're actually emptying the hospitals as much as we can because we know it's going to hit. We know that trends are heading up. We're seeing increased number of critical care beds with patients with COVID-19 across the province, across Toronto. So it's about to happen, we know, within the next really couple of weeks we're about to see. So it really is dependent on that. In terms of sort of treatment, as mentioned, there's no treatment that works. There's a couple that are being sort of repurposed that they're looking at that have shown some anecdotal suggestion that it may help, and that's hydrochloroquine and remdesivir. There's probably going to be others that people are searching that may work, but these are really early, and it's people don't realize that even the most studied sort of research papers, or I should say medications that have research papers in the highest, the best, the New England Journal of Medicine, there's a large percentage of those that get reversed. And there's so much more we're learning that these little anecdotal kind of signals are great. And we have to sort of bounce off them, and hopefully one of them hits, but it's really early. One of them, called Calitra, we thought would be have some promise. It turned out it didn't. So we're still working on that end. On the vaccination end, vaccines typically take about 1.5 years. So we are still, everyone's trying to rush things as much as possible. We're starting, there's been trials in animals. We're going to start human clinical trials shortly, but we're still probably 1 year away from anything like a vaccine. So.
That's so disheartening because, the whole world is shut down, and you think to yourself that, are we going to stay shut down until we're in a place where, we're comfortable that there is a vaccine that is going to be able to help us? And, that's kind of one, a frame of thought. The other frame of thought is there's still so much confusion around why this particular COVID-19 has shut down the world when there's a ton of other viruses. And as you've mentioned as well, some of them are, pretty drastic in terms of the death toll, etc. Obviously you're a medical doctor, so you can't speak on behalf of how long we as a general public are going to be sitting in, the aisles of life and waiting for when we can kind of get back to normal. But it is at least a great thing to know that what you're saying is really what we're hearing out there, which it kind of centers around the fact that you don't take these possible anecdotes seriously until you've had the opportunity to really, really work at them. And obviously time is required to make something like that happen. I want to ask you, Doctor, can you tell me what the facts are on the pandemic, where public is concerned? What is it that we need to know as a public in terms of helping navigate, not letting it kind of get out of hand on our side? Because really that's the reason why we're shut down. And there's so many different things coming out there that it's quite confusing to know what we should actually be doing. So as a doctor, from a medical perspective, what are the 2 or 3 things that you would say that we should be doing as a general public?
Sure, and that's such an important question. Before I get to that, I do want to mention one thing which sort of piggybacks off what you had said, and is sort of at the tail end of my previous statement, in that there is this concept of immunity too. So we use vaccines so we can become immune, but there's also natural immunity. And if we know how viruses work, and it's very common that after you're infected, you will have at least some degree of immunity to the virus. So what they're actually, the FDA down in the US actually fast-tracked a trial to allow people to use people who have been infected, their blood, and transfuse it into people who are newly infected. So they're going to see if that works. And, there is some promise and hope there. Again, very early. We don't know yet because we just don't know how much immunity you'll get from that. But that does give us a little bit of hope. So I do want to, at least add that there. Now, to your question about what the public needs to be aware of. So based on everything that I've already said, as you probably already know, we don't have any treatment right now. There's no vaccination. The only thing we can do is prevent the spread of disease between people. And that is in the public's hands. That is in everybody's hands right now. So how do you spread it? You spread it through respiratory droplets. You have to prevent getting it, through your mucous membranes, et cetera, to decrease the risk of infection. You have to wash your hands. You have to really almost be obsessive about washing your hands. You need to keep a clean environment and wipe things down. You need to cover your mouth, not with your hand, but with your, sleeve or a Kleenex, so that you're not spreading it. So that hygiene is incredibly important. And then the second part is around this physical distancing. And really, if you just imagined, the incubation period of this disease is around 2 to 14 days. That means after you get the virus, the symptoms typically will show up between 2 and 14 days, usually within the first week. So if you just imagine everyone just shut down and sat in their own room for 2 weeks, you'd actually have to double that because someone might actually have the virus right now and be at the start. And then in 2 weeks, they would show symptoms and you would not want to go in 2 weeks because they would infect. But for the length that, say you have the symptoms for about a week, if everyone just stood still for about a month, the virus would be gone. If we all just did a coordinated effort and everyone said, everyone shut down, don't go outside, not even once, don't even go around your husband, wife, don't go around anybody. If everyone shut down, the virus would be gone. I don't want to say completely gone, but you get the concept that, the rate would be dramatically lower. So what we try to do with physical distancing is try to emulate that as much as we possibly can while still preserving as much sort of normality as we possibly can, because you still, people still get sick. Myself as a doctor, I still have to go to the hospital, but to take care of COVID patients. So we want to try to get by with bare minimum. And the quicker we can do this as a coordinated effort, the quicker we can move through this. If there's still a percentage of people who are out there and they're just living normal life and they're going on the beach, it's not going to work because, as I mentioned, this is infectious. People will spread. You don't even know you're spreading it. And another reason this is, back to the first question, why this is so hard to contain is because there's so many people who have mild symptoms. And there's even studies showing it's those people with mild or barely any symptoms that are the ones out there often spreading the virus and causing these numbers to go so high. So those are really, wash your hands and take it seriously when you physically distance yourself. Even if you may not be at risk and you're willing to take that risk, everyone has to be a tiny percentage better than they are for the whole world to be better.
Right. Absolutely. Great words. So let me just ask you something, Doctor. In the hospital, when you go there, what is it that you face on a daily basis? Is it a different situation or is it a controlled situation and you know really what you're going to be facing? Like, give us some sense of what it's like from your perspective as a medical doctor.
Yeah, it's a good question. Again, it really depends on where you are. We all have different services. So when patients come in, as a general internal medicine doctor, we typically are the ones that are taking care of the patients as an inpatient. So next week, as an example, I'm going to be on at Credit Valley Hospital, Trillium, where I work. I'm going to be the attending physician on the COVID ward, for example. So there I'll be primarily taking care of just COVID patients. But, there's still other patients in the hospital. So we have different rotations. I may be taking care of other patients. But even then, there's a separate eye, just knowing that COVID-19's out there and it can be sort of anywhere and the circulation's everywhere. We're taking much more precautions around making sure we don't do extra things that we don't need to do that might cause increased infections, et cetera. So, there is certainly a feeling of, anxiety to some extent, because no matter where you are, even if it hasn't hit you yet, you almost know it's coming soon. So at this point, any hospital in the world that hasn't realized it's probably coming soon is not preparing. There's probably something wrong there if they're not prepping. So I think there is a little sense of, anxiousness no matter where you are. So
to that point, we're hearing a lot of stories in different parts of the world where, hospitals are running out of resources. Hearing about, Dyson coming up with a ventilator machine. We're hearing about alcohol distilleries that are creating, hand sanitizers. What kind of, level of danger perhaps do you think we're in our hospital situations here in Canada, from your experience in perhaps being in a situation like that?
Yeah, I mean, first I'd like to say that, it is really amazing to see so many people chip in and try to contribute to the cause. People want to donate. People are retrofitting their operations to help, fight this battle that everyone's in. On the flip side, there are those people who are price gouging, and that's obviously very unfortunate to see. And I think that is a small percentage. I mean, imagine during COVID, doctors and myself and nurses and everyone, raise the price on, services provided. We would never even, think about that. So,
Right.
it's just really unfortunate that we see that tiny percentage, but I think most people are in this battle, which is, one real positive that we've been able to take out of this entire situation. So in terms of our preparation in Canada, we did have some donations out to China, and they've returned them back because they're in a better position now. I think we're seeing again a lot of industry ramp up their operations. Even just personally, I have people reach out to me all the time because they know I'm in healthcare and involved in the system from around the world, other friends and colleagues who want to help with different sort of donations. And I think the biggest thing is really how well the public physically distances from each other and how well they wash their hands and how well they decrease transmission between each other. That's going to determine how many people are sick. And
Right.
that's going to determine how many ventilators we need and all the different sort of personal protective equipment that we're going to need. Because if that number keeps going up, there's almost, it's tough to control it. But if people try to, as people say, flatten the curve, we may be okay.
Right. So how do you, I mean, from your experience, your knowledge, how, whereabouts do we fare on the, on the totem pole of positive and negative from around the world? Like, where do you think we're sitting in that? Because obviously we know that our southern partners there, the states are sitting at number one right now. Where do you think we're faring? And so that's one part of the question. The other part of the question is, do you see as hitting some sort of a danger peak that could possibly, have us falling down the rabbit hole? So two parts to that question.
Yeah. So in terms of where we stand in Canada, one thing, we were prepared a little bit more than some other countries because of SARS from 2003. And, sometimes situations like that can prepare countries better. Korea had MERS hit them and they were more prepared. So I think, even when I look at my experience here in January, my role as chief medical director of TD Bank, everyone coming from China, everyone coming from high risk areas, I would scrutinize all their cases. We would, even if their family members were, we had protocols in place. We were taking this very, very seriously from the moment it got on our radars in January. And I think because of that, we are doing okay. We've had some trouble with our testing. It's a complex process that has several parts to it. And I think some other countries have done better than us with their testing, and they've been prepared for that. And when you're able to test, that's the other big piece of this equation. When you can test and isolate exactly who is sick and who's not, you can better quarantine those people. You can better control the virus instead of giving sort of a guesstimate on who is and who isn't. And I think people take it more seriously too, when they know that they actually have sort of COVID-19 compared to something else. They're, even if they're that, I talked about being a little percentage better. I think those people become a little percentage better. So I think there's a big sort of behavioral sort of psychology piece there that we overlook when we don't test enough as well. So I think overall, we're doing above average as a country, I would say.
I want to ask you, in terms of the kind of support that you're getting from, the government side, is it enough? Like, are you getting enough support? And you mentioned that, there's a lot of kind of community public awareness of support as well. How are we sitting in terms of that? Because I'm saying this and asking you this question purely because you hear the stories outside of Canada of, they're just really, not being as much resources. And I guess, as somebody that lives in Canada and knowing that this is a country that is always so supportive in every aspect, are you getting the kind of support that you feel that you should be getting? Like, are we good?
Yeah, I think we're overall doing pretty well, right? Nobody's perfect. No government is perfect. I think when you just look at things globally, we've done a pretty good job. Some of the things governments, in general can do is really put in those policies that force people to physically distance. Really, those are the ones that, there are some jurisdictions in various places of the world that haven't enforced this yet. And even in areas where the numbers are going up, usually you want to try to do it sooner rather than later as well. You nip it in its bud. But, so we're lucky that the government has done that. We're, lucky that they're providing, proper information to the public, right? We have trusted resources everywhere. We have, they've taken the personal protective equipment and sort of ventilator requirements. They've taken that very seriously, I think. At our hospital at Trillium, Christine Elliott, the health minister, jumped on and talked about how this is something that they've really ramped up and that there is going to be supplies coming in, as an example. So, I've seen that the governments do that quite well. I think even things like helping us physicians take care of patients at home, that's a policy decision to some extent, because when you shut down and you have to take care of people at home, you have to use things like telemedicine as an example. And they've moved pretty quickly on helping physicians and other people get reimbursed to do sort of these virtual consults, which has been something I've been working in sort of this virtual care area since 2003, because my background was a software developer. So, I've never seen a jump in sort of policy around the world that has allowed, especially here in Ontario, where now suddenly we're allowed to do this. And, I wrote this on my application essay 16 years ago, and it took a pandemic to really accelerate things. So I think they have. I think even, some more things that we're going to have to see around the world that governments can do is, having militaries help out hospitals is one thing.
Right.
And I think probably the big thing, again, where I mentioned this before, I think on the testing front, we probably could do a little bit better. I think testing is so important, and there are ways to do this, and we can. I've seen so many. China built a hospital in a week, so I think we can. There are areas for a little improvement, but I think we overall are doing pretty well. So
that's wonderful. Well, it's been tremendous hearing it directly from you, Dr. Nikore. I just have one final question I want to ask you, just because we're, as a public, we don't get insights into really what's happening out there. And I have to say that I feel so much better talking to you than I do, listening to politicians on television that constantly keep changing, what's going on and changing kind of the perspectives that we have as the general public. And that's kind of a whole other discussion. But I did want to ask you that there's a lot of photography on the internet showing doctors exhausted, showing them sitting on the floors of hospitals, sleeping on the floors of hospitals. Is this the case in Canada from your experience? Like, what is happening there is, it's a very scary thing to see for us as the general public.
Yeah, so and understandably so, based on the pictures, and I think it really depends again on where you are in Canada. Places like Montreal have had, outbreaks, and I'm sure the workers there are starting to really feel that clinical exhaustion. I think here a lot of it's been in the preparation. Personally speaking, through my role at TD, I've been, really trying to stay up on everything since mid-January. So that's almost 2.5 months now. Half my day is spent on coronavirus, looking at papers and managing the situation. So there's preparation happening within our hospitals. So I think everyone is working tremendously, even if it hasn't hit you yet. With Home Care Hub, with my company, we're trying to prepare all our home care agencies so that when they go into, when patients go get care, they can be prepared. We're building out new models of care to take care of patients at home. So, I'm kind of going flat out between these sort of three initiatives. And usually the acceleration on all three of the things that I'm working on aren't all at 150% capacity, but they are right now. And
Wow.
I'd say, yeah, most physicians, if it hasn't, the ones who are, and we'll probably know in about a month how we're feeling from a clinical standpoint. I'm sort of ready to work, nonstop clinically as whatever is needed. And I think a lot of my colleagues are. But I think even if you're not at that peak yet, people are working really hard in advance to try to be able to handle things when that peak comes.
Which, when do you predict that might happen? Any ideas?
Yeah, there's different models and different predictions out there. I've been keeping an eye, obviously, on a lot of community cases and things that happen. I think April is a huge month. I think this is really a call to action for the country this month in April, and that's going to determine how high that peak goes and when it will end. I do think probably within the next sort of month, April, May, that peak will occur. But again, if we don't sort of physically distance ourselves, if people don't hand wash, if we don't put all the measures in place, that could be pushed out later with a higher peak and more people infected. But I'm hopeful. So.
And you're hopeful, we're hopeful. Thank you so much for your time, Dr. Nikore. It's been such a pleasure. I mean, the insights that you brought just really do make me feel better. I really hope that you get all the support that you need from us as the public. And final thing is, where can we donate? Where can we, help the situation here outside of some of the things that you've already been talking about?
Yeah, that's a great question. Most, depending where you are, most governments do have sites to donate on. I think I did see one on the Canada government website, and they had sort of matching places to donate equipment, et cetera. I know most hospital foundations, I know at Trillium, we just had this morning an announcement, asking for donations to our hospital foundations. And I think most hospital foundations have the same. There's organizations like Canada Helps, use reputable ones no matter where you are, and they have links to various different places. We're trying to get donations. I run a nonprofit as well to help, that's called Leading Youth for Empowerment, or UFLO, and they're working with Home Care Hub and other places. We're all trying to get things to frontline workers in the community as well, for people going in home. So lots of different areas, but those are a few that come to mind there.
That's wonderful. Thank you so much for your time and your insights to all of this. I really, I look forward to seeing how April fares, and I hope that, this opportunity to chat with you is going to allow people to feel a lot, better about the situation, and also to just kind of do as we're told, to be very honest, like do as we're told to do, and hopefully we can ride this tide sooner rather than later. Thank you so much for coming on my show and for giving us your words of wisdom. Thank you.
A pleasure. And just one last thing, things are getting a little better in China. So, that is signs that there is hope. And if everyone stays at it, and it's just important to really stay positive during these times.
Absolutely.
There are times, and just there's still a lot of grateful things that we can be grateful for, even just connecting with people through FaceTime, catching up with people, using this time to spend with your family, whatever it might be. So as long as you're physically distanced with your family, of course. But yeah, so it's a good time for reflection as well. So
absolutely. Great thing. It's interesting because so many people are getting into mindful meditation and, yoga and, all of these wonderful things that we look at this from a negative perspective, but there's so much good that's also coming from this. I mean, the world really is stepping up. I mean, the public really is stepping up, and we really are wanting to know how we can, help more than we're helping. And, people are, just coming on social media and just kind of supporting their networks out there. And I think that kind of morale that you're talking about is a really important place for us to, sit with and be in right now.
Absolutely. I think we're going to come out stronger on the other side once we get through this. So
absolutely. Thank you so much for your time.
Thanks. As always. Take care. Thank you.